Hi, and thank you for joining us today. I'm Kelly Parsons, CEO of WaterAid America. And as you saw on the slide just now, WaterAid is the largest international organization dedicated exclusively to making clean water, decent toilets, and hand washing available for everyone, everywhere. Now, as we work all around the globe, we're accustomed to the challenges technology can bring, and certainly in this time, we all work remotely in many ways. So if we have any technical difficulties today, we ask for your patience in working through it. We've got a broad reach here at WaterAid, and when COVID hit, we did what WaterAid does best. We tailored our programs to fit the local context and the local needs. Since April, we've been sharing highlights from the different countries in the world in which we work through our emails, our newsletters, and webinars like these around how WaterAid donors like yourselves have helped us in responding to the pandemic. We hope you found these stories powerful and compelling, and we look forward to showing you a bit more today. In our time today, we're going to tighten the lens down and show you the impact that you, our WaterAid donors, have had in one country, Madagascar.
In Madagascar, coronavirus continues to spread. We've got more than 10,000 cases. Unfortunately, most of our work has been paused, but WaterAid country program continues its support and its COVID-19 responses activities to help communities and particularly vulnerable people to face this pandemic. WaterAid is also looking for innovative ways in our actions to minimize the risk of contamination. Hi everyone, it's Ernest here. I just wanted to share with you what we are going to do today. In fact, our program team and engineer at WaterAid in Madagascar have designed a new and contactless hand washing stations. So what we are going to do is we are going to load the car and then we are going to go to the field and put these in public places like local market, and then health centers and then school, just to help those who really need this critical time. So we're just gonna go now, and then I will be filming and we'll be sharing with you guys what we are about to do. So as you can see, we are on the way now to the field, but while traveling, let me explain you the equipment we are taking to the field. It's a contactless hand washing stations. I would say a foot-operated hand washing. You've got water tanks. Water tanks are mounted on the stand, and you've got hand sanitizer and soap dispensers. Everything is mechanically linked to pedals fixed at the bottom of the stand. This new design is part of WaterAid emergency response to contain the spread of coronavirus.
Tena manara-penitra mihitsy. Tsy mampiasa tanana fa tongotra miasa. Amin'ilay aretina zany, ilaina mihitsy ny sasa ilaina madio, mbo ilana amin'ilay aretina.
Mahasamihafa ilay fanasana amin'ity dia tsy mila mampiasa tanana fa ny tongotra fotsiny no miasa.
Tongotra amin'ity zany dia tsy mampiasa tanana mivezivezy fa tena tongotra fotsiny dia ny tanana tena hoe voadio miala amin'ilay toerana.
Fanasana zany miarantsika amin'ny valana aretina virus.
As you can see, I'm in this homeless people shelters in Tana. In fact, some homeless people from Tana have been displaced in here, and WaterAid is installing a contactless hand washing station here to allow these vulnerable people to clean their hands and to keep the virus away from them.
Zavatra hitanay teto dia vao tonga io dispositif napetraka WaterAid io dia niazakazaka ny ankizy kely nanderana asa tanana, zany hoe mazoto ireo ankizy ireo hiditra ao anatin'ny fahadiovana, fa omeo azy ilay fitaovana dia afaka miditra ao anatin'ilay fahadiovana izy.
And now, live from Madagascar, please welcome our Voices from the Field officer, Ernest Randriarmalala. Ernest, I hope I got your name okay. We're so happy to have you with us today and see that you're safe and well. We'd love to hear how you and your family are doing.
First of all, thank you for the effort in pronouncing my long name correctly, Kelly. My name is among the shorter ones in Madagascar, though. Hi, everyone, or as we say here in Madagascar, salama. Thank you all for having me. It's a massive pleasure to be virtually with you all. My family and I, we are pretty good. Health is good. The situation isn't easy for everyone, so we are trying to not complain about things as we have the basic things we need at home, such as a mask, hand sanitizer, a place we call home, something to eat, and water to drink. So yeah, things are pretty good. Yeah.
Fantastic. And if any of our webinar attendees have questions for me or for Ernest, please submit them in the question and answer tab or box at the bottom of your screen. We ask when doing so that you please include your first name and where you're joining us from. Thank you. So Ernest, tell us a little bit more about your role at WaterAid Madagascar. What exactly is a Voices from the Field officer?
Thank you, Kelly. My role is to visit communities and document our work. I go into the villages and the neighborhoods before WaterAid start a clean water or sanitation project. I get to know the people who live there, learn about their lives, and collect their stories through photography and interviews. And after WaterAid completes the project, I go back and help show how their lives are transformed. So from my own experience, I know firsthand how access to clean water is vital for children to get educated and stay healthy, and for community to thrive. You know, when I was a child, I started to fetch water for my family at a very tender age. I had to collect water for my family from a dirty water source. It was at the bottom of the hill, which was really tough and dangerous work, especially during the rainy season. We knew that the water was not safe to drink, but this was the only option that we had. And every day, a classmate would miss school because of tummy aches and diarrhea. And at this time, because I was so young, I just thought that it was normal because it happened so often. I thought at this time I thought it was normal to be sick. So I've seen how life-changing and how life-saving it is to have clean water. I wish all our donors and supporters could see it. And for me, what I'm doing, I mean, my job, this is the best job in the world because it gives me the opportunity to capture and share the smiles and happiness when community gets safe water for the very first time. And you know, something I will never forget as a field worker was that smile of a 85 years old lady smiling even with her teeth while she was you know, drinking clean water for the very first time. It was something really amazing.
That's fantastic, Ernest. Thank you for bringing this work to life. As you know, on our call today, we've got donors who've helped WaterAid in responding to the COVID crisis, as well as in prioritizing WASH for years. And they know how important it is to make sure everyone has clean access or access to clean water and sanitation, so to keep themselves and their families safe. Seeing the footage that you shot there and shared with us, I was struck by a few things. Although I saw some people were wearing masks, some weren't. And so they're obviously trying to protect themselves from catching COVID, as everyone is, but there's still many, many people on the streets. What are the guidelines in Madagascar with respect to COVID?
There are regulations around mask wearing and social distancing, but in reality, poverty doesn't allow people to stay home. They need to go out every day and buy what they need for the day. You know, most people here in Madagascar don't have money to buy food for the next day. Many people mainly work as porters, street vendors, you know, carrying heavy loads of fabric and shoes, or, you know, taking laundry to wash for the wealthier people. And their jobs require them to be there every day, or they won't get paid. You know, something like simple, you know, even a fridge is seen as a luxury in Madagascar. There are so many households in Tana, in the capital city, who do not have refrigerators, so they have nowhere to like store the food. And you know, life is really tough for many people. Most of the Malagasy people live a hand-to-mouth existence, and unfortunately, to make it worse, there is not a system of social care, social health, which can provide food or medicine or financial support in a regular way. So people don't have choice. Many people's jobs are insecure and manual. So if they don't go out to work, then they don't get paid. So that is why you can see in the video that social distancing is not really followed when people are earning their money for the day and selling their produce in the markets.
Thank you, Ernest. You shared a photo that I just love, that you took from the window of your own house. I'd love you to tell participants on the call a little bit about this photo.
Yeah, this view is from my window, and it shows a man carrying his yellow jerrycans. Every day since the lockdown began, I have noticed him on his way back and forth from a fountain, hundreds of meters away from where he is now. And he's one of the water carriers in my area, and fetches water every morning for many households like mine. Because like mine, many homes in my area don't have like running water. And you know, as I took the picture, I noticed that he didn't have a mask. So I stepped outside and gave him a washable one to protect himself. And when I asked him, he said that with or without COVID, he has to work and fetching water for others to be able to buy food for his own family. But what you know is like his job is so crucial for many people in my area.
Thank you. Ernest, when you went to film the video that we saw a little while ago, Madagascar had been on lockdown for 3 months. What was it like for you going back to the field after that time?
When lockdown was over, I had an experience where I went back to the community. I was wearing a mask to protect myself and communities, as well as you know, following WaterAid's rules and procedures while traveling and visiting communities with this pandemic. And people there felt that I was judging them because I was wearing the mask in front of them. So they believed that their community was virus-free, and they were feeling a little bit like insulted at first. So many people in rural communities do not have access to information on how to protect themselves from the virus, and that's why WaterAid is working to change this. So I was able to explain that wearing a mask is important because it keeps others people safe. But it was also like difficult to keep my distance from people in the communities who know me and who want to greet me like their friend, like their family, because this is a really big part of my job. I have a very close relationship with people, so for me it was really strange not to be able to embrace people, not to be able to like hug people, to shake their hands, and even just like holding the mic for social distancing when I was filming was really challenging. But what is really nice was to be able to see WaterAid's work in action, and to be back in the community doing my job. I don't know if you could tell by the video, but it was right near the cooking station. And once we set it up, children were running to the device to wash their hands. And for me, it was really amazing and really brilliant to see these guys to be able to wash their hands and rush into to the device. And when I was there, I was seeing so many people suffering and having to deal with so much. And personally, it made me realize that I should not be taking every little thing that I have at home for granted. And after seeing that these guys have practically nothing.
It's so true, Ernest, and what a lesson about taking things for granted in all of our lives. At this point, I'd love to remind folks that if you have a question for me or for Ernest, please submit them in the Q&A box below. And again, include your name and where you're from. Ernest, in addition to the hand washing stations that we saw, those portable hand washing, tell me what else WaterAid Madagascar did in their response to COVID and the crisis.
Yeah, thank you, Kelly. WaterAid Madagascar has broadcast TV and radio messages and instruction about the importance of hand washing with soap. We distributed like posters on behavior to adopt and to protect oneself from the coronavirus. And we did lots of awareness raising, social mobilization, because there is a need to get the right information out to the people so they know how to keep themselves safe. And when we set up the hand washing station, a woman spoke to me about how amazed she was that the station worked with that soap. And then I was shocked. As we teach them to wash hands with soap, and we often say no clean hands without soap. So it took me a while to realize that that she had never seen liquid soap before. So she didn't know what it was. So we had to explain that it worked the same way as a bar of soap. So what I'm trying to say is that getting the right information out to people is very important. And as well, in addition to the busy city centers and homeless family shelters we show on the video, we also set up these foot-operated hand washing devices in marketplaces, health centers, hospitals, and school across the capital city in Madagascar.
Fantastic. What a powerful story about the liquid soap. So as our long-term donors know, WaterAid does much more than respond to a crisis. We're trying to make clean water, decent toilets, and hand washing available to everyone, everywhere. So we work on these long-term and sustainable solutions, and a big part of that is getting governments to do their part. I know you're enthusiastic about the progress that WaterAid Madagascar made with the government in their COVID response. Could you share a little bit about that with us?
Yeah, of course. We are working to making, clean water, decent toilets, and hand washing normal for everyone everywhere. But, even an NGO as big as WaterAid can't do it alone. And the need is really huge in places like Madagascar. And the solutions must be tailored to fit its situation. So that's why we partner with the governments, NGOs, partners, corporations to model what is effective, share best practices, and advocate for government funding. As you said, Kelly, we know that we amplify our own reach when we activate the government and other partners to help bring clean water, decent toilets, and washing to everyone. WaterAid Madagascar team met very recently with the Senate, and we got a good result. The government decided to increase the budget for water, sanitation, and hygiene in Madagascar. Of course, we had a lot more to do before it is like fully funded, but for us, this was already a big progress. Because of the pandemic, we had the government's attention, and the message about funding wash program is now starting to get through, because before it used to be I would say a neglected area. So WaterAid Country Program is also providing technical expertise to the government and the Ministry of Health, the Ministry of Water, the Ministry of Population in their action to help communities face the COVID-19. And when the whole world turned its attention to the importance of hand washing, the government of Madagascar turned to WaterAid for guidance and how to make it happen for them, the Malagasy people. So they know that that we are the hand washing expert, and they really trust WaterAid to have the the latest information and innovative solution, such as this foot operated hand washing device. And the ministry has called all the other NGOs working in Madagascar, like UNICEF, to model what we have done and set up hand washing station like the one that we've just seen on the video.
That's fantastic. What progress and what an accomplishment for you all. Thanks to everyone who has been submitting questions. It's great to see how much interest there is from donors and this opportunity to speak directly with Ernest. While we're only going to have time for a couple of questions, it's making me think that there's a need to do more of these opportunities to engage with donors. And so we want to connect you very much to the lives you're saving through your investment in WaterAid. And because none of this would be possible without you. So thank you. I'll take a first question coming in. So Joan from New York asks, how does WaterAid keep the hand washing stations working and filled with water and soap?
Okay, yeah, thanks, John, for the question. I mean, WaterAid empowers like people in the community to maintain the systems. This is what we do with all our interventions, and the hand washing station are not different. We work with local authorities, local community, and local partners so that they can continue the good work even after we are gone. So, for example, the homeless shelter, they have organized a committee to clean and fill the water tanks and soap. And in the more rural areas, we train communities association to maintain the device and make sure that this is available. There is always water and soap so people can wash their hands at any time.
Fantastic. And here a question's coming in about at the beginning of the video, there's health centers or schools, but there's a structure that doesn't have running water. And Susan from Chicago asks, how big of a problem is that with healthcare centers or schools in Madagascar that don't have access to water?
Yeah, Madagascar is similar to most of the developing world. So wherever fewer than half of the health centers have running water or decent toilets. For example, this building is a school, so it could be a health center. So you know, each of these doors in the entrance could be an exam room. So this is a typical of what many health center buildings look like in rural Madagascar. So you know, nurses and midwives have to you know, when they don't have water, nurses and midwives have to collect water for their health center to be able to wash their hands. And I just want to share that I remember I did an interview with a nurse after they get running water, sanitation blocks, and you know, hand washing device. And she told me that during their prenatal visits, she used to remind pregnant women and their families to bring water and jerrycans to fetch water for their stay and use at the health center before and you know, after the delivery. So so they have to fetch their own water you know, on the way to the maternity ward, or send out a family member to do it for them. So in my role with WaterAid, I've seen health centers before they get water, and then visited them after they get water, after we work there. And what I can say is that the difference is really huge. It really changed lives for the midwives, the nurses, pregnant women, and the babies to have clean water in these health centers. So the difference is really, really big.
Yeah, what an image, Ernest. I just think about packing my own bags to go to the hospital to have kids a long time ago. And the idea of bringing a jerry can of water and soap with me, it's really foreign to us. So thank you for sharing that. And for everything that you've shared with us today, Ernest, our appreciation. Is there anything else you'd like to share with our donors, just your own words, before we let you go?
Yeah, let me think. After I was filming at this homeless shelter, the manager of the homeless shelter come up to me and told me to please give her thanks to the donors who made the hand washing station possible. So you know, when someone come to you and say these words and say thank you for this, thank you to the donor and supporter, we are nothing without you, we kids are safer now and healthier, they can wash their hands, you know, these are the kinds of words that go straight to my heart. And you know, when you hear that, you really feel like you are doing something amazing. And I was feeling so proud of what we were doing and what we have achieved, and what we have done so far. So particularly for those who really need us at this critical time. So Maybe I just wanted to thank you all on the behalf of the Malagasy people for allowing WaterAid to help others, or as we say here in Madagascar, msot, or thank you.
1, 2, 3, action.
Hello, namaste.
Salama, hi everyone.
Hello, everyone.
Hello, everyone.
I just want to pass on a great thank you.
I am sending you a big thank you.
Thank you
for helping us to transform lives
with clean water
in countries across the world.
This is Liva, our driver, is the best. It is so amazing to feel that we may be miles apart, but we are definitely one. Without you and your valuable support, we would not be able to keep working and supporting those who really need us during this difficult time. So as we say here, Veluma, goodbye and stay safe.